Today on Brisbane Health, we've looked at the importance of physical fitness and the negative effects of smoking. The Deadly Choices program also focuses on the importance of accessing local primary health care. Now, Keiron, can you tell us how important is it for the Indigenous community to be reaching out to local healthcare centres?
Yeah, it's massive. It supports our Aboriginal medical services here in southeast Queensland, or whether you are in the state or in the territory or other parts of the country. But accessing primary health care is part of the prevention. I think that's the biggest key that we're trying to strive for, is prevention is better than a cure or maintenance in other terms.
And are Indigenous people less likely to reach out?
Yeah, they are. There's a lot of factors around why our communities don't visit their local AMS. Sometimes it's distance, especially in an urban setting. It's a fair way. Transport is a big thing for our community. Fear is a massive thing. They don't understand what is part of a health check or a health assessment. So that's part of our education as well, is educating our young people and our community members so they all understand why it's important to see their GP, their local GP, and visit their local Aboriginal medical service for just a checkup. And then hopefully that brings down that number that we all look at around death rates amongst diabetes and cancer and heart disease.
Yeah, and also to be letting them know to not be scared that, you know, the doctors in the Aboriginal centres are helping.
Yeah, that's right. And I think our males are probably more stubborn than most, and understanding that it is important for them, especially our older communities, to visit that GP so our young community members know that it's okay. I mean, it's that trusting that we build, and we build a good relationship around sustainability for our local Aboriginal medical services.
And so whereabouts are these centres?
At the moment, I think we have 13 across southeast Queensland. There's one at Woolloongabba, one at Capella Bar, one at Stradbroke Island, Northgate, Deception Bay, Strathpine, Ipswich. So we have a few, and there's a few more that I could mention. So we are creating more services because we do have a great population of Aboriginal and Torres Strait Islander people in southeast. We are roughly about 50,000. So we need, more local GPs and Aboriginal medical service, so we don't, I suppose, fear that aspect of health and that prevention that we're trying to strive for.
And do you know if there is more people, as time comes on, that they are seeing their GPs more often and things like that?
Definitely. We've made part of our programs and part of our sporting days that to be a part of them, you need to go see your local service and get a health check. And once then you're registered, part of our Daily Choices education program is all our participants need to have a health check. And then they're understanding that importance then of what it is. It's not scary. How often does it need to happen? Once a year, and the aspect of get away from that fear factor. Okay, there is opportunities, and I think there's more there to an AMS than just getting a health check. There's dentals and paediatricians and nutritionists in there, so there's other aspects that can help with lifestyle.
Yeah, covering all the bases there. I think that's very clever that you've brought that into your system. So if they weren't, going to get into sports, trying to follow in your footsteps, then you're going to go get that health check. And so what sort of things do you think are important for them to be looking out for, like in a typical health check?
Well, a health check is simple. They check for your weight, your height, your eyes, your teeth, your oral, blood test, blood sugar. It's very basic, so it's comprehensive. So they do also talk about your social well-being, how you're feeling mentally, because that's a big part of our community that we probably shy away from, depression and mental health. And if you look at some of the alarming statistics around that, 1 in 4 Australians may suffer depression every 12 months. So it's something that we need to highlight. Your physical aspect, are you being physically active? And also your diet, are you eating well? Are you looking after yourself? And they all link within each other. And that social aspect, are you with friends? Are you drinking? Are you smoking? Harmful substances, those sorts of things. But nothing's scary. Everything's private, it's confidential when you see a GP, so we go from there.
Yeah. And what sort of costs would be involved?
Free.
free.
Free, so it is free, and there are subsidised medication for those who may have a chronic disease or history around that. So medication is cheaper or free, which helps that cure and management of chronic illness as well. And like I said, it's free, so there's not really an excuse not to go.
Yeah, that's so good, helping people come through. Is there what sort of chronic diseases, are seen throughout the Indigenous community?
I think diabetes is a large one. The amount of sugar content that our community members take in is quite alarming around soft drinks and even simple as orange juice. We don't understand that, and again, we link that in our program so we understand sugar and nutrition side of things and heart disease. They're all linking to one another, whether it be smoking, nutrition, physical activity, or harmful substances in some cases.
And are you finding people taking on all the aspects and trying to live a better lifestyle? Oh,
definitely. It's all we aim to do is plant a seed. So you're starting to at least think about how to live a healthy lifestyle and how does that then impact on my family and my friends.
That's right. And what else? What other aspects of Deadly Choices do you cover? You've got health, diet, and that sort of thing. But you were saying about education.
Yeah, Deadly Choices links with everything. Deadly Choices is the word that we're saying that it's about choices. It's not about someone telling you what to do. It's more about you being educated a little bit better and then making better choices for your lifestyle, for your career. And I always talk about it in a holistic approach, whether it be work or an education or music or sport, whatever that person, I suppose, involved with, you need to be healthy. Otherwise, it's a bit hard to succeed.
Yeah, that's right. And with education, I guess children coming through, if they are finishing their education, then they might be better off knowing about their health and things like that.
Yeah, definitely. I think those who are well educated within finishing high school, especially our Year 12s, if they have more knowledge around nutrition and physical activity, it can lead into sports at university, it can lead into nutritionists back into our local services or dental nurses, whatever it may be.
Are you seeing a lot of that? People coming through are finishing an education in the Indigenous community and then, going on for bigger and brighter things? Oh,
definitely. It's growing immensely. It's still very low. I think 50% of our high school students are finishing, and that is up on previous numbers, so we need to be better at it.
Thank you so much, Keiron, for coming in today.
Thanks for having me.
If you'd like further information on the topics discussed, please visit the Brisbane Health webpage on www.31.com.au. You can also follow us on Facebook and Instagram. Thanks for watching.